Hi, I am Dr. Mahesh D M, consultant endocrinologist at Aster CMI Hospital, Hebbarn. Today, we'll be talking about the symptoms of diabetes. Diabetes has two types mainly, which is type 1 and type 2 diabetes. Type 1 diabetes is seen usually in children, and the most common presentation of type 1 diabetes is increased frequency of thirst, urination, and excessive hunger, and most important, associated with that is weight loss, which is unexplained. So most of the time children may not notice this and they may end up in getting into the hospital directly, and they will have stomach pain and breathing difficulty, and they end up being diagnosed as diabetic ketoacidosis, which is the most common way in which children present in the ER or the emergency department, and diagnosis of type 1 diabetes is made. Now let us move on to type 2 diabetes. Type 2 diabetes is usually seen in adults and young children, sometimes where they are overweight or childhood obesity, and we also see commonly in adults and elderly people. So the most common symptom of type 2 diabetes is usually tiredness, fatigue, giddiness, burning sensation in the feet. They can also come up with urinary tract infections, genital infections, and respiratory infections. They also have wounds that don't heal, especially in the foot. When you have a cut, it doesn't heal well. So we usually ask for a blood glucose to be tested. Nowadays, we are also seeing patients with toothaches or tooth problems getting tested for blood glucose, which means that dental infections are also a key part of increased risk of diabetes or its detection. We also should remember that diabetes is asymptomatic in many people, so a routine blood testing is essential to find out whether you have diabetes or not. Sometimes we have early cataract, which is blindness that comes, at an early age. Usually, we expect cataract to come after 60, but if somebody has cataract at the age of 45 or 50, we do suspect that they may have diabetes. So, diabetes can affect all parts of our body, including the brain, heart, and kidneys. So, we actually see people coming directly with a heart attack, stroke, or a kidney problem, and then find out that they have diabetes because it was neither not noticed or the mild symptoms were not given importance. So, diabetes can be detected at the first time when you have a major complications, or it can be detected very early when you have very mild symptoms. So that's why we need to check our blood glucose levels frequently, especially after the age of 35 to 40 years. If we have obesity or family history of diabetes, we need to check our blood glucose levels. So these are some of the symptoms of diabetes which will help us detect diabetes early. Do visit at Aster CMI Hospital, Department of Endocrinology, to not only know more about diabetes but also learn about other endocrine problems like thyroid disorders, obesity, pituitary problems, growth and puberty related disorders, problems related to bones, that is osteoporosis, and also we also take care of calcium and other electrolyte imbalances in our department. We also evaluate for secondary hypertension, where the blood pressure is because of some endocrine disorder, usually related to the adrenal glands. Thank you. Visit us at Aster CMI Hospital.